Blurring of vision generally is the most common symptom. But again, early detection is more important. So we ask patients to see the ophthalmologist once a year, even though they don't have eye symptoms yet.
Yeah, that's a good advice, Doc JM, because but I'm sure you hear this from your patient. Doc, lumalabo matanda yung mata ko, tumatanda na yata ako, and they think, just changing glasses fix it, but you should always consider if you're diabetic that it might be related. But is it preventable? Blindness caused by diabetes?
Okay, many of the complications of diabetes can be prevented with good sugar control. So all these complications we mentioned, the heart attack, the stroke, the kidney failure, the blindness, the nerve damage, the infections, if you can get your sugars controlled, then you can live a long life that is free of complications of diabetes, as long as you control it early in the course of your disease. Okay, so I know earlier in the video we mentioned that if you have these symptoms such as frequent urination or weight loss, then you might have diabetes. But our emphasis is that even without symptoms, you might have diabetes, especially in the early stages. Pag medyo mataas na yung blood sugar, wala talagang naramdaman yung mga patients. That's why screening of asymptomatic people is very important. Our current recommendations in the Philippines, if you're 40 years old and above, regardless of your risk factors, then you should be screened for diabetes with a fasting blood sugar test. Now, if you're younger than 40 years old, but you're overweight and you have additional risk factors like family history or you're not exercising as much, you have hypertension, then you may want to be screened for diabetes even before the age of 40. But universal screening is recommended starting at the age of 40, whether or not you have symptoms.